All right, everyone. Thank you for joining us. We are live for a session of question and answers with myself, Dr. Deigni. So get your questions ready. We're going to be discussing body contouring procedures tonight. For those of you who regularly follow us and join us for the lives, thank you very much. We appreciate it. And also thank you for coming in for your consultations and also joining us virtually for your consultations. And for those of you who are new to the channel, we want to welcome you and let you know that there is a form on the bottom left of the screen, and it should be available for you to put in your name, phone number, email, and a message about what surgeries you're interested in having, and we will reach out to you and get you on the books and also guide you through the whole process. Please go ahead and share the link with your friends, especially if you know they want to have surgery. And our phone number is 281-724-3138. So we've got a wonderful set of questions that we've gathered throughout the week from your questions on various topics. So thank you for your DMs and thank you for your messages also on the videos that I post. I appreciate it. And thanks for your support. So don't be shy, ask your questions. Again, I'm Dr. Deigni. I'm a board certified plastic surgeon. I practice in Houston, Texas, and I specialize in body contouring procedures. And I will be discussing this tonight with you guys. Mommy makeovers, breast augmentation, breast lifts, breast reduction. We're going to be talking about liposuction, BBLs, the body lift procedures, any surgeries after massive weight loss to really help with your recovery and also your body transformation. All right. Shadi Ice 7 is saying, do you provide a nurse for after the surgery? Okay, we don't provide a nurse, no. The way I do these procedures is to make your recovery as easy as possible. So you don't require nursing assistance or a skilled nursing facility or like a recovery home. But we do offer those options for those who would like to be in a recovery home. We usually will tell our patients when they travel to come and see us that they can book an Airbnb or a hotel, or if they have friends or family here in the Houston area, they will stay with them. But we do require that you have adult supervision for at least the first 24 hours after surgery. So if you don't and you're coming and traveling by yourself, then yes, at least the first night you'll be staying at a recovery home or house. And then after that, you're free to continue your recovery with any choice of place. So it could be Airbnb, it could be a hotel. Follow-up question: can I get a BBL and a mommy makeover at the same time? Yes, you can. So it all depends on what your goals are and what you present with. So we have to examine you. I will examine you during the consultation. If you're coming in from out of state, out of town, or even out of country, we will start the process with a virtual consultation. You will send us pictures, and then you'll also fill out your medical history. So through your patient portal, so we can get all of that information before I meet up with you, and we'll have a very productive consultation so that we can get an appropriate treatment plan and get you in for your procedure. All right, so for pricing, please go ahead and contact us, 281-724-3138 during business hours, 9 a.m. to 5 p.m. Central Standard Time. Or the easiest is just put your information in the bottom left of the screen and we will reach out to you. My patient coordinator, Linda, will contact you, give you an estimate based on which procedures you're wanting to have, and we'll be happy to share that information with you. We also offer financing options for our patients. We offer 4 of them: Patient Fi, Care Credit, Alphion, and Cherry financing. So it's fairly easy to contact us. We'll give you the links. You can apply, and usually the response will come back fairly quickly. Negrita Bonita, revision tummy tuck 360 black. Okay, so you're interested in a revision tummy tuck and a 360 lipo, I guess, or is it like a 360 tummy tuck, so like a body lift? I do revision surgeries for patients who had procedures before and are interested in actually getting some improvement. So definitely contact us. We'll have you come in for a consultation. If you're out of state or out of town, we will be happy to start with a virtual consultation. You're very welcome, Charlie Ice 7. Look forward to taking care of you. So please go ahead and contact us or put in your information in the bottom left of the screen. That's the easiest. That way we can reach out to you. Okay, you're from New York. Wonderful. East Coast is in the house. All right. We get some people that travel from New York and the Northeast as well to come and see us for surgery. So we'd be happy to take care of you. So I think for you, what we'll do is we'll start with a virtual consultation. You'll send us your pictures, fill out your medical history, and then we'll be able to meet up and discuss which procedures exactly you will benefit from, and we'll be happy to get you in for your surgery. All right. Thank you guys for joining us. Appreciate any questions that you have. We're discussing body contouring procedures. I'm a board certified plastic surgeon. My name is Dr. Deigni, and I specialize in the body contouring procedures. My signature procedure is the drainless tummy tuck, and patients really love that procedure. So it makes a lot easier for you to be able to recover faster and smoother. Mo that sit. Let's see here. You're very welcome, Negrita Bonita. Looking forward to taking care of you. Okay, Sheila Rivera 8 is tuning in from Mississippi. Thanks for catching us. I love it. Yes. Okay, you'll be coming from New York City as well, Shiny I-7. Okay, perfect. We'll be happy to take care of you. Like I said, we get quite a few people from New York to come down to get their procedures done here too. So, and again, for pricing and all that stuff, please call us. We'll be able to give you an estimate. When we do the virtual consultation, once I've actually gathered the information as to what you exactly want to do, and I can see your pictures, it gives me a better idea. Oh wow, we got somebody all the way from New Zealand. Thank you. That's the farthest I've had on the live. Once I get your pictures, understand kind of like what goal you want to achieve, then we'll put together the treatment plan, and based on that treatment plan, we'll be able to send you an exact quote. That's going to be what you're going to be paying for your surgery. So that's at the end of the consultation, and we can get you something. Before then, if you're interested in ballpark pricing, we can get you some budgets and some pricing. Well, that's it. Is saying my massages didn't happen. Can you still do a tummy tuck? I think I have fibrosis or seroma due to lack. So it all depends on what you present with. So I'd have to see you. We need to have you come in so I can examine you and I can palpate your skin and see what we're dealing with. And we'll be happy to take care of you, okay? Free soul from New Zealand. All right, thank you very much for joining in. I appreciate that. That's one place I haven't been to, and I would love to go and visit. Okay, so how to contact regarding the BBL. So the easiest for you to contact us is put your information. There should be a form in the bottom left of your screen. Click on it, put in your information. That way we'll be able to reach out to you. Give us your phone number, your email, and your name. The other thing is you can also call us. Our phone number is 281-724-3138. And we'll be happy to answer your questions and guide you through the process. Ardit is asking, won't the fat migrate after liposuction? So fat from the fat transfer. Leonie from Jamaica. Hey, we are very international tonight. That's wonderful. So won't the fat migrate after liposuction? So when we transfer the fat, so for example, if we're doing a correction of your hip dips or putting some fat in the buttock area for BBL, it's in an area that has not undergone liposuction. So the fat doesn't migrate. It stays exactly where we put it. If you were to do liposuction and you put the fat exactly in the spot where you did the liposuction, then yes, there is a risk of the fat not staying exactly where you want it. But again, it all depends on which plane, where you're removing the fat and where you're actually putting the fat. So it all depends on where you're doing the work. But we can definitely direct that and meticulously place the fat where we need it to go. All right. Great questions. So Free Soul is asking, apart from fat transfer, is there any other option for BBL? So not really. Well, the BBL is a combination of liposuction and fat transfer. So with the liposuction, we are able to contour your body, which gives already the appearance of a fuller hip and buttock area. On top of that, then we do the fat transfer, and that really accentuates what has been done. So the sculpturing really helps through the liposuction. Now, if you don't have enough fat, you can always get butt implants placed. But I don't place butt implants, and I wouldn't recommend it because I feel like there are quite a few complications that can happen with butt implants. And overall, that's not an option that I will recommend or perform. So I've done them in my training. It's just not something that I do in my practice because I prefer to do the fat transfer for the butt area. Thank you very much, guys, for the gifts. I really appreciate it. And thank you for the questions. If I missed your questions tonight, please go ahead and just contact us and we will get to your questions. Okay, Misha Stone is asking, what determines skin elasticity? So skin elasticity has to do with a variety of things. It's part of your genetic makeup. Also, the structures that make up the skin. So the components of the skin, the collagen makeup. Over time, your age as well, how much there are environmental factors as well that determine it, how much time you spend in the sun. If you're sunbathing, tanning, and things like that, that can damage your skin. If you're smoking, that can also affect your skin elasticity. Once we hit about 22 or 23 years of age, we start to break down more collagen than we actually form. So over time, we see the structures of the skin to really lose their support. And that's why you start developing signs of aging and things like that. So there are treatments that we do to help stimulate the collagen regeneration. And we do that on many different areas of the body. For specifically the face, I'll do that with some radiofrequency treatments. And for specific treatments that we do for women in their genital area, we help to stimulate the collagen in the vagina and around the labia to pretty much rejuvenate that area as well. Because there are some women who will come in and they say that they've lost some elasticity, they've lost some volume, and there's some sagging and the skin is wrinkly. So we want to treat that as well. And that really helps to soften things and increase the blood flow there, increase sensation as well, and also increase lubrication. So that's very helpful. And also it helps with women who have some stress urinary incontinence. And that's Thermiva is the treatment that I'm talking about. It is a radiofrequency treatment that we do for women to help that elasticity as well. Free Spirit is asking, can you do this with high blood pressure? Yes, I have patients who have high blood pressure. As long as your high blood pressure is adequately controlled on medication, we can move forward with surgery. So I've had quite a few patients who have hypertension. And let me just back up, I guess, and just talk about medical conditions in general. That's another question that we really get quite commonly. Patients who have type 2 diabetes, high blood pressure, thyroid disease, autoimmune disease, and things like that, we have to make sure that your medical conditions are adequately controlled before we move forward with surgery. And if you have high blood pressure, we can definitely get you on the books as long as it is under control. Hey, Jackie Mary, nice to see you. Hope you guys are staying warm out there in Louisiana. We got this cold front coming through. All right. All right, I'm just going through the questions here. Thank you. I was just talking with my friend about the tummy tuck. She's asking questions and wants it done. Thank you. Perfect. She's pleased with my results. Love it. Love it. Love it. Love it. Thank you for being I guess, what do you call it? Not an influencer, what's the word? Thank you for sharing your experience and actually demonstrating the results with people in your circle of friends. I really appreciate it. And for referring them to us. All right, so Dana is asking, what is the risk of weight gain after liposuction? Will the fat return if you gain weight? I gained only 10 pounds and I feel like I ruined my results. So definitely when you do these procedures, it is an investment. So it is to your benefit to, yes, I'm sure it's cold out there, Jackie Marie. It's to your benefit to really maintain your weight. 5 to 10 pounds should be okay. If you get 10 to 15 pounds, it may actually change your results. So when you get liposuction and you gain weight, so a significant amount of weight, so 10 pounds, 15 pounds, 20 pounds, you will put on, accumulate some fat. That may not necessarily appear where we did the liposuction because we've removed those fat cells, but there are still some fat cells that stay. So those areas can still get fatter. Especially if you continue to accumulate weight. So yes, it can happen. And if you ruined the results, my advice is definitely get onto a lifestyle that will bring that weight down and see how it is. So if you lose those 10 pounds, see if your results are still not as good as you would like them to be. And then after that, you can definitely get a revision surgery then. Hey, how's it going? All right, you'll be in Monday. Perfect. Looking forward to seeing you. I hope you're doing well and staying warm. All right, thank you very much. I appreciate it. Yes. Okay, I think I've answered all the questions so far. So please go ahead and continue to ask your questions. Share the link with your friends. Let them know that we are live. All right, so I'm also going to answer some questions that I've jotted down because you guys have been, I get them from the DMs, from the comments on my posts, and then from, of course, all the questions that we get when people call in. Jen is saying 350 cc is good for this. 300 cc is good for what? 350 cc's is a volume. Let me know what exactly you're referring to. Is it for the breast augmentation? Is it for fat transfer to the buttock area? I need to know a little bit more what exactly you're referring to, and I can discuss this a little bit more. Of course, I can't really give you any information specific to you without seeing you and examining you, because say, for example, let's just take, for example, a simple breast augmentation with an implant. A person who's 5 foot tall, petite, and we're going to put in a 300 cc implant is different. It's going to have a different result than someone who's 5'7" and curvy. And if we put a 300 cc implant in that's going to be a very, very different result. So I needed a little bit more context to know what the 350 cc's refers to. CK is saying, is lipo worth getting if you are bloated every day? So if you're bloated, there's something other than, it's not the liposuction that's going to fix that. Now, the liposuction is going to help to contour your body. So you have to decide, is contouring your body worth it? Do you have excess pockets of fat that really bother you? It could be your love handles, your belly area, your bra line, your back. That's what's going to determine whether or not you'll be happy with those results. Bloating is different. It has to do with your digestive system. There's something inside. So definitely, if you have bloating, you would want to either follow up with your, thank you very much, follow up with your primary care doctor to get appropriate workup to see what is causing that bloating. Okay, so Ashred1113 is asking, how often do you run into patients that get an infection after surgery, if any? It's very rare. So infection is probably 1% or less. The majority of patients may have more of a little small opening in their incision. We call that some delayed wound healing, and we discussed that specifically in the consultation and especially at your pre-op visit and when we sign the consents. But infection is quite rare. There have been, like I said, it's usually less than 1%, but we make sure that you're adequately treated. We put you on some antibiotics and we catch it soon enough to be able to take care of it. All right, so let's see. Great questions. 78 Boss Lady is asking, arm reduction after weight loss. Yes, I've performed some arm lift surgery on patients after weight loss. So they'll come in, they'll have a combination of some excess loose skin and also still have some excess fat. So I will typically combine liposuction with the skin excision. And typically, most patients who come in and have a lot of excess skin that bothers them and it extends from the elbow to the armpit, I will actually put the scar from the elbow to the armpit to remove that and give them a much nicer contour. Perfect. Thank you. Thank you very much. Thank you for the questions. Lower abdominal, doc said it wasn't worth it having 6 children. Like I said, it all depends on what you present with, how much excess fat you have, if you've got a pannus, if you've got separation of muscles. There's a lot more that is there that we need to be able to see for me to be able to answer your question. So you're welcome to come in for a consultation if you are in the area. We'll be happy to have you come in for your appointments and take care of you. Vicky Aisu is saying, please answer my question. I haven't seen your question, so please go ahead and repost and I will see if it shows up. Sometimes TikTok just doesn't post the question, so we don't actually see it in the feed here. You're very welcome, Ashred 1113. You're very welcome. All right, let's see here. Okay, so great question by 78 Boss Lady. The scar can't be transverse under the armpit. I'm not at risk of mobility issues. So you can get a scar that's hidden only in the armpit, but that's for a specific type of excess that you have. So if most of your arm excess that bothers you is just right here underneath, for example, my sleeve, then we will limit the scar, the incision, to the armpit, where we can actually pull some of that. If you've got a lot of loose skin that goes all the way to the elbow, the scar in the armpit is not going to fix that. This is too far away. To be able to remove that, we have to actually put the scar there. So it all depends. I've operated on patients where they only get the scar in the armpit, but again, it depends on what you present with. But yes, a scar in the armpit for an arm lift can be done in the right patients. Lee Rodriguez is asking, I had a paniculectomy. Is lipo worth without a completion? That's a good question. A paniculectomy usually is just a removal of that overhanging pannus, which means that they haven't fixed the separation of your muscles. They haven't pulled down your excess skin in your belly, especially in the upper part, all the way down nice and tight. So it depends on what you present with, what your end goal is. Without examining you and seeing you, I can't really let you know what will be the best treatment for you. You could go either way. Again, it all depends on what you present with and what your end goal is. If you want to be nice and tight, have your separation of muscles fixed, liposuction is not going to treat that. You will want to get the completion of the tummy tuck. Okay, Jack Murray is asking, what's the difference between an extended tummy tuck versus the incision that goes all the way around? Okay, so the extended tummy tuck, some patients, usually with the tummy tuck, it goes from hip to hip. But some patients have a little bit more excess. You can see it in them. So we have to extend that tummy tuck a little farther out. The difference between that and the hip lift and butt lift is that the incision goes all the way to the back to actually treat a lot of the sagging in the hip area, the buttock area, and the lower back. So that's the difference. So that really goes all the way around to treat a lot of that skin excess and sagging that patients will have, especially if they had a lot of weight loss. If we do just the tummy tuck, it won't treat the hip and back and the buttock. So that's all. The body lift. So that's what we do. That's why I do the body lift. And the main thing is I explain it to my patients during the consultation and during the pre-op visit, and I actually pull the tissues up so that they can see what I'm talking about. So, and not everybody decides to get the body lift, but definitely I explain to them so that they know if they only go with the tummy tuck, there are limitations to that procedure. You're very welcome, Lee Rodriguez. Thank you for participating and for asking your questions. Again, everybody, put in your information in the bottom left of the screen. There should be a form, and we will reach out to you, answer all your questions, and guide you through a process. We'll be happy to have you come in for your consultation. Or if you are out of state or out of town and not able to come in to Houston for your consultation, then we will start with a virtual consultation. So, all right. So I was going through, keep asking your questions. Okay. I appreciate it. And I was asking, I was answering some other questions that I jotted down. Okay. So another one is age. So this person was asking, am I too old at 49 to get these body contouring procedures? No, you're not. Age is not really the limiting factor. It is more so your overall health. So I've operated on patients in their 50s, 60s, and even in their 70s, and they have done extremely well. So as long as you're healthy enough to be able to undergo general anesthesia for us to move forward, then we'll be able to do the procedures and you'll recover well and enjoy it. So being 49 years old or in your 40s is not really a limitation. Let's see here. Okay, so we talked about the extended tummy tuck and the body lift. We talked about the medical problems, so diabetes or high blood pressure. So we definitely have to make sure that those medical conditions are adequately controlled. And let's see here, BMI. Okay, another question that always comes up, and I'm surprised it hasn't come up tonight, is what is the maximum BMI? So for me, it's 35. Anything higher than that, we have to get your weight down to be able to move forward for surgery. But again, it all depends on how you carry your weight. So in very few select cases, I will operate on patients who have a BMI that's higher than 35, but it's based on their physical examination, where they carry their weight and what type of procedure they want to get done. But blank statement, max BMI is 35. And let's see here. Okay, so another question that people ask quite often is what is the difference between the tummy tuck, so the regular tummy tuck, and the drainless tummy tuck? So that has to do with when I close up everything. The traditional tummy tuck, you close at the belly button area and also on the bottom. That's where you put your stitches, and then you put drains in to drain that whole space. In a drainless tummy tuck, I actually put stitches all over because that helps to put your tissues together so that you're able to heal much faster. It decreases that open space where the fluid could collect and you can develop a seroma. So that really decreases it and allows you to heal much faster. And it also allows you to walk upright much faster than if you have the traditional tummy tuck with the drains, because of all of the work that I do to really get your tissues to start healing from day one. It's Ray's World. Thank you for joining and asking your question. What is the typical recovery time for a body lift? Okay, so the body lift is a combination of the hip lift, butt lift, and the drainage tummy tuck. I also always treat the mons pubis area, so I always do a fupa repair on all of my patients when I do a tummy tuck. So the incision goes all the way around your belt line. Recovery time typically for my patients is within 5 to 7 days. They wean off their pain meds. They come back to see me a week after surgery. They're walking upright. It could be slow, but they're walking upright. They're showering, typically on their own, changing their clothing, wearing, pretty much getting back to their daily living activities on their own. Most of my patients will wean off their pain meds, like I said, within the first 5 to 7 days. Then after that first appointment, they're usually able to go back to work after that first week. At 2 to 3 weeks, they're walking a lot more. So going back to the gym and doing some aerobic activities. So walking on the treadmill or walking around the neighborhood, walking in a park, as long as it's safe and you enjoy that. And then by the time you come back to see me, usually at 3 weeks, you've progressed extremely well. At that point, we go ahead and we'll start with your scar treatments. You'll do it at around 4 weeks. So 1 week after your 3-week visit with me, you'll start your scar treatment. You'll start going back to the gym and increasing your activity level. At 6 weeks, you're doing light resistance training. So you can start using weights. After that, you will be able to go without any restrictions to the gym around 6 to 8 weeks. So that's usually how the recovery is for most of my patients. Yes, the best procedure that I've done was doing the drainless tummy tuck. Thank you, Jackie Marie. Absolutely. I think it's, and thank you for sharing your experience as well, because I know you were very apprehensive about the recovery process, the pain, all of that, and you did extremely well. And I thank you for sharing that experience and letting other people know how your experience went. Question mark. Hello, what is the ballpark price for medial thigh lift? Okay, good question. So for pricing, I don't have the prices. I don't keep the pricing with me. So please contact my office. We will be able to give you a ballpark price for these different procedures. The easiest way is just put your information in the bottom left of the screen there, or just call us 281-724-3138. But yes, like I said, the easiest is put your information there. My patient coordinator, Linda, will reach out to you. Okay, so it's Ray's World asking as a follow-up question, and how long should someone from out of town plan on being in Houston? Usually you'll be here for about a week, because I usually see all my patients post-operatively at 1 week. So it could be anywhere between 5 to 7 days, depending on when exactly you have the surgery and when my next office visit will be. But most patients will be around 5 to 7 days in Houston, traveling from out of town, out of state, even out of country. So as long as you're doing well, recovering well, you'll be able to return within a week back to your home. And we'll go over all of that in great detail when you contact us, and we'll be happy to answer all your questions. Yes, definitely. Will do. Thank you very much. Yeah, thank you very much for your question. Question mark. And we'll be happy to take care of you guys. Like I said, a lot of my patients actually come. You're very welcome, It's Ray World. A lot of my patients come from TikTok. They come from out of town. They come from out of state. We've got a lot of people flying in from West Coast, from the East Coast, from Florida, and then anywhere in the Midwest. We also have people coming in from Canada and outside of the US as well, in different countries. So it's always nice to meet you guys in person. Of course, we'll start the process with a virtual consultation, and then you come in for your procedure. Usually you'll come in about a day or two before your surgery is scheduled, so we can meet in person, go over the plan, make sure everything's good. We get your medications ready, and then you'll have your procedure. And a week later, usually within that 5 to 7 day mark, you'll come back in for your follow-up, and then after that, you're usually cleared to be able to travel back home. So every plan, of course, will be tailored specifically to you. So we definitely will be able to know exactly what we're going to be doing once we've had the consultation and we know a lot more information about you as well. Perfect, perfect. All right, I just want to make sure I'm not missing any other questions before I answer some of the other questions that I've jotted down that people have asked throughout the week. So we talked about the recovery from the body lift. Recovery from a mommy makeover is fairly similar. Again, it all depends on what specific procedures you place in your mommy makeover procedure. So the mommy makeover is kind of like a term that encompasses multiple procedures. It typically will combine a drainless tummy tuck and some type of breast surgery. It could be a breast augmentation, a breast lift, or a combination of those. So yes. Thank you very much for your comment there, Jackie Maria. I appreciate it. She's saying, yes, a lot of people don't do that. They want the cheapest price, but you have to know what the doctor does. Exactly. So a lot of people price shop, which I find to be the wrong way to actually look for your surgeon. You have to make sure that you do your research. I recommend that you see a thank you. I recommend that you see a board certified plastic surgeon that you're comfortable with when you interact with them, that you meet with them before the day of your surgery, either virtually or in person, that they answer all your questions, that you're very comfortable before you move forward. There are some people who come in and say they went to this other place, they never got to meet the doctor, they just didn't feel comfortable. They had scheduled the surgery, they were about to go have surgery, and then they'll cancel like last minute and then come and see us. But definitely, please make sure that you do your research. It's very important. Vicky Aisu, okay, this is your question. Can you come alone for a tummy tuck when you're out of town? You can come alone, but you'll have to recover with somebody. So at that point, if you're coming alone, then we will make sure that you stay at a recovery home so that you have some adult supervision for the first 24 hours. After that, you can move out of there and then go to a Airbnb or a hotel, because at that point, after those first 24 hours, usually after a tummy tuck, you should be able to start really taking care of yourself and without needing anything as far as like skilled nursing or stuff like that. So you should be okay. Visha 17, about to go to Sono, but I like your work. I just don't do well with going under. Okay, so Sono Bello is definitely another one of those factory places. Please do your research. We do have patients coming back after their visit to Sono or Mia or one of those other places who want to have revision surgery. So it's your body. You're free to choose your surgeon. I just want to make sure that you guys do your research, that you're comfortable with the person who's going to be doing your surgery. Make sure that the surgeon actually is the person who's going to be doing your surgery. A lot of these places have assistants. They're not medical professionals. They're just assistants that actually do the majority of the surgeries. So it could be hit or miss in those types of facilities. I'm sure there are some very good doctors there as well, but you never know. So do your research and pick the surgeon that you feel comfortable with, so that they can take good care of you. All right, let's see here. A couple more questions here. Oh, okay. Yes, some doctors don't give the patients their meds until after the procedure. I would never do that. Yes, definitely. So I always prescribe the medications before, because I want you to have everything beforehand. You have your kit, you have your post-op bag, you have everything ready. If you forget your post-op bag, I will bring it to the surgery center so that you have it, you can leave with it. But the medications, absolutely, you must have them before, because we don't want anything to happen after the surgery. From pharmacies closed or they ran out of the medication that you need. we can't have that. So it's always important for you to be able to get your medication beforehand so that all is well. Lolo Daly is asking, what is the most important pre-op preparation for a tummy tuck? So that's a difficult question to answer. If you're a smoker, you have to quit smoking. That would be extremely important. If you're overweight, we have to make sure that you bring your weight down to a safe side. Otherwise, if you're healthy, you have no issues, you don't smoke, drink, if you drink socially, you don't do any drugs, you don't smoke marijuana, you don't have anything that's going to be compromising your lungs or increasing your risk of bleeding. The most important pre-op preparation, I would say, just stay in a healthy lifestyle. Make sure that you're exercising regularly, that your body is fit. That's going to really help you for your recovery. Those are kind of like I guess, answers to that question. But definitely, we will be happy to answer specifically for you if you contact us, and we'll be happy to take care of you. Truly blessed one, Dorothy. Welcome back. How expensive are recovery houses, and are there usually is there someone there to assist afterwards? Yes. So I don't know what the pricing is, but they're not overly expensive. We've had some patients who've come in from out of town who request recovery homes, and so we have several that we recommend, and they seem to be reasonably priced. So definitely, they have the personnel to be able to take care of you, and definitely they'll be happy to. We'll be happy to actually give you some regulated goods content. Okay, we got the next restriction liability. Discussing drugs and other regulated substance. I'm not sure why people are really hating on this live. 2 restrictions. It's like every time we have a live, somebody has to report something that they don't like. It's really annoying for one, but definitely unfortunate because people are actually enjoying this, and I'm not sure why you would report discussing restriction medications. It doesn't even make sense. People are asking stuff for surgery. We have to discuss this. Regardless, if you don't like the live, please leave. We don't need you to restrict the reach because people are actually interested in this important information, and you're really doing people a disservice. So I don't understand this. But anyways, for those of you who are still here, I appreciate your questions, and I hope that you're finding this to be worth your while. Okay, there you go. So here's a question about the BMI. What is the BMI limit? And I just answered that about 10 minutes ago because I was surprised nobody had asked. The BMI limit is 35. We need to make sure that your BMI is 35 or lower because with a higher BMI, there's a higher risk of wound healing problems, surgical complications, and we want to make sure that we can mitigate those. So looking forward to having you come and see us. I'm excited. I always enjoy meeting you guys in person, and I appreciate your comments and coming in to do your surgeries. A5904912. Does your office offer non-surgical methods for skin tightening? Yes, we do. So for that, I will do ThermiSmooth, which is a radio frequency energy-based device that helps to it helps to regenerate the collagen in your skin that supports your skin. And we talked about this at the beginning of the live. That was a great question that somebody asked. And it helps to regenerate the collagen in your skin, which we break down more than we actually make once we're about 22 or 23 years old. So there are different things that we can do for skin tightening. Again, it all depends on what type of skin you have, how extensive that skin laxity is, how much loose skin you have. Because sometimes the non-surgical methods may not be adequate. So you're very welcome. Truly blessed one, Dorothy. I appreciate it. Thank you very much. Thank you very much, Jackie Murray. I appreciate it. I thank you for sharing your experience with us. Yes, I try to I explain everything as much as I can. I really want you guys to understand what you're undergoing, what procedures we're doing, what the limitations are. Sometimes, no matter how much we explain it, people still don't get it. So I really try to break it down and make it as easy as possible, and repeat myself multiple times to give you the best information. Okay, Kenya OH is asking, can you explain the awake arm lift procedure? So I don't do awake arm lift procedures, so I can't really explain it. I would imagine that people will inject some local anesthesia and go ahead and do the arm lift. But I do it with my patients asleep. It's a lot more comfortable for my patients, and I'm able to remove a lot more tissue and be a little bit more aggressive with the liposuction when you're asleep. So I don't do awake arm lift procedures. Perfect. Okay. I think. Okay, so Kenya always asking, how is the BMI calculated? So it's based on your height and weight. So I have some videos on my TikTok feed that explain how it's calculated, and I also show you step by step how to calculate it. The easiest is just go to Google and type in BMI calculator. One of the links that you'll see is usually the NIH. That's the one I click on, and you'll see the BMI calculator right there. You put your height, your weight, and you'll see what your BMI is. So just for just for some references here. Let me see here. Just for some references, if you're 5 foot tall, your maximum weight would be 179 pounds for you to be at a BMI of 35. If you're 5'4", your maximum weight will be 204 pounds, and then you'll be at 35. Anything less than that will put you at a lower BMI. If you're 5'8", it's 228 pounds, and if you're 5'11", it's going to be 246 pounds. So that's kind of like an idea of where your BMI of 35 would lie based on your height. But you can definitely find that very easily on Google. You love to be awake during surgery, Justin. So not everybody can withstand being awake for surgery. The awake procedures that I do for my patients in the office are the upper eyelid surgery. I do lipoma removal as well, which is fat pockets, fat collections, balls of fat that people will have underneath their skin. I do breast implant removal. I also do labiaplasty, and what other procedures with people awake? Some small scar revisions and things like that I'll do with people awake. Anything bigger than that, usually I have you asleep, especially if it's liposuction. I've done liposuction with patients awake, but you can't be as aggressive. So if I want to do, for example, a lipo 360, I wouldn't do it awake. I will put you asleep, make sure that you're doing, you're more comfortable, your sleep, I can really be more aggressive, and then we treat your pain with medication. Most of my patients, we want their pain level to be anywhere between 3 or 4 out of 10, nothing more than that. If it's more than that, we need to adjust your pain meds appropriately based on your, and I usually always give my patients the lowest dose that will get them comfortable. So if it's not working for you, we adjust it. We've got plenty of medication to get you comfortable to where you can wean off your pain meds usually within 5 days after the surgery. And then if you are still a little bit uncomfortable, usually you just switch back to some Tylenol or some ibuprofen, some anti-inflammatories for short term, usually 3 to 5 days, and then you'll be done. Can you operate on patients with high blood pressure? Yes, we can. I operate on patients who have high blood pressure, as long as they are adequately controlled. So most patients, most patients who have high blood pressure will be on some pain medication, and then we'll be able to take care of them. So thank you, Jackie Marie. You're saying yes. So Justin likes to be awake for surgery, but most people want to be asleep, especially if they are anxious or have any kind of anxiety. Okay, so let's see here. Millie and Ali is saying, I had fat removed on my upper eye. Now I cannot close my eyes while sleeping and have dry. Oh, sorry, I'm trying to get to the rest of the comment. I'm not sure why. And have dry eye. What can I do? I would say, please go ahead and follow up with your surgeon who did your procedure. They should be able to evaluate you and see what can be done. There are things that can be done to reverse that. So I would want them to actually examine you and see exactly what needs to be done. Could be anything from massages to surgery, to actually try to help lengthen the eyelid so that you can actually close your eyes. In the meantime, definitely please put some over-the-counter water drops and also some ointment in your eyes to keep your eye from drying out. Yes, Jackie Marie, I remember you said you had zero pain. And that was a blessing in itself. I'm so happy. I'm so happy. It's not common that patients will have zero pain. I've had quite a few. I would say probably maybe 10% of my patients have zero pain, which is surprising to me, especially when we do these big procedures. But with the combination of the Expra injections and the drainless technique, it really helps to have you heal much faster. And then you take the pain medication just to be on the safe side. And like I said, most of our patients will have pain levels around 3 to 4 out of 10, and we don't want it higher than that. If it's higher than that, we're not adequately managing it, and we can definitely play around with the medications, how soon, how frequent you'll take it, reduce the interval between the pills, increase the number of pills, or even add an additional type of medication. So definitely there are ways that we can do that. So Niche Dance is saying, what about having keloid skin? I want a tummy tuck. So not everybody that actually is prone to keloiding will necessarily form a keloid if they get a tummy tuck. It is difficult to, probably even impossible to prevent a keloid if you are prone to having keloids. But you have to decide if you were to develop keloids around your tummy tuck scar, see if that's worth having that keloid or the potential that you could develop a keloid, or if you want to keep that excess skin and pannus and separation of muscle. So it's a personal decision. Now, if you develop a keloid, there are definitely things that we can do to help. Oh, thank you very much for the comments there. I'm just now seeing it. There are definitely things that we can do to help remove that keloid or improve it. Maricela is asking, Dr. Deigni, what BMI do I have to be for a mommy makeover? So for my patients, I want them to be, the maximum BMI is going to be 35. Anything lower than that is better. So if your BMI is a 30 or 32, that's very good for a mommy makeover, especially if you want us to do some type of fat transfer. We want you to be anywhere between 10 to 15 pounds from your goal weight. Anything higher than that, if you lose that weight, it's going to change your results. So BMI 35 or less is what we would like for you to be at. And thank you for your comments. Let's see here. Oh, okay, Justin is saying, I'm scared of sleeping, doctor. I understand. A lot of patients are anxious about going under. And the way I explain that to my patients is general anesthesia is very safe in the right people, as long as you're healthy enough to undergo it. So if your heart can withstand it, you haven't had a heart attack, you don't, if you have high blood pressure, it is well controlled. If you've got other types of medical problems, they're medically optimized. If you're able to walk up 5 flights of stairs without being exhausted and completely out of breath, if you're able to walk a mile too, things like that will kind of give us an idea of what your level of fitness is. If you're in great shape, you'll be fine undergoing general anesthesia. It's very safe. Great questions here. Okay, so Vicky is saying I had a virtual consultation last year with you, and I was told I need to lose 20 pounds. Okay, so for patients who need to lose some weight, we do put some patients who need it. We will put you on a weight loss treatment, which will be the semaglutide medication. And usually, most patients will lose that 20 pounds within that first 3 months. So we will start with a 3 month regimen. It could be anywhere between 3 to 6 months. Everybody's different, but that will actually allow you to lose that weight so you can qualify for the surgery and we can go ahead and move forward with the surgery. So give us a call, contact us, and we'll be happy to start that process for you. Wonderful. Um, okay. Okay. Daria J. Smith 99 is saying, my goal weight is 150. Should I wait until I'm 150 or is 170 okay? That's a good question. So you're 20 pounds away from your goal weight. It depends on what surgeries you want to get done, where you carry your weight, and what you currently look like what your anatomy is like. So you're not too far. I would say you could start your consultations now. So if you wanted to come and see us, we can definitely start. Because if you wanted to lose so let's say an ideal situation. When you come to see us, we'll give you a quote. The quote is going to be good for 6 months for you to schedule your surgery. And the reason being is prices can change because of anesthesia, and facility fees usually will continue to go up. So over a 6 month span of time, we should be able to honor the quote that we gave you. Anything longer than that, prices may change and we have to renew the quote and adjust. But that being said, if you're 20 pounds away, usually most patients will be able to lose 10 to 15 pounds easily within that 6 month period of time. You probably even 20 pounds. Like I said, some patients who are on their medications or really aggressive about their lifestyle changes are able to drop 20 pounds within those 3 months, 3 to 6 months. So if you come in to see us, I think by that time you're ready to go forward with surgery, you will have already dropped that weight and we're ready to actually continue to move on for your surgery. So contact us and we will be happy to get you started and get you going. Put in your information in the bottom left of the screen. We'll be happy to take care of you. All right, everybody. I think that pretty much wraps up our situation, our Q&A for tonight. Our session, not our situation. That pretty much wraps up our session for tonight. I really appreciate everybody joining us. Again, I do this every Tuesday or and Thursday, time permitting, around 7 p.m. Central Standard Time. And hopefully we won't be getting restrictions. I know people have been putting restrictions on these lives. I'm not sure why. If you don't like it, just move on. We don't need you to restrict us. There are people who are very interested in this information, especially when it's legitimate and important information. It is very hard for you guys to find appropriate information on social media. Even doing research and stuff, it can be very tedious. So we're always happy to be able to answer your questions and give you some valuable information to get you ready for your surgery. Until next time, have a great weekend, everybody. Stay warm and God bless you. Bye-bye. Hey, Soul Bean. Thank you for joining in. I hope you're doing well. It's been a while. I see you on Facebook every once in a while. So take care and God bless you. Okay. Bye-bye. Okay, YouTube, we are signing off for tonight.